Yeah, Assalamualaikum and good morning. I bid to all. I am Vera, representative from Group 21, would like to present our research entitled Incidence, Clinical Characteristics and Outcomes of Tropidolaemus Species Bite Envenomation in Malaysia consulted to Remote Envenomation Consultancy Services from 2015 to 2021. So here is the members of Group 21. This study was conducted under Department of Emergency Medicine and was supervised by Prof. Madya Dr. Ahmad Khaldun Ismail. Let's start with capsule summary. So why is this topic important? This topic is important because there are poor documentation and poor awareness regarding the clinical characteristic and significance of Tropidolaemus species bite envenomation in Malaysia. This topic also important because there is lack of clinical evidence for the optimal management of Tropidolaemus species bite envenomation. What is already known about this topic? We already know about morphological characteristics and geographical distribution of Tropidolaemus species in Malaysia. We also know about the venom components and toxicity of Tropidolaemus wagleri. What questions has this study addressed? This study addressed the incidence, geographical distribution, clinical features, and clinical outcome of Tropidolaemus subannulatus and Tropidolaemus wagleri bite. This study also addressed the validity of WHO statement that classified Tropidolaemus subannulatus under WHO Category 2, list of medically important venomous snakes in Malaysia. How is this knowledge relevant to clinical practice? This knowledge is relevant to clinical practice as it provides verified and reliable information regarding the clinical characteristics, significance, and clinical outcomes of Tropidolaemus species bite cases. This knowledge also relevant to clinical practice because optimal management can be provided to patients for the most favorable outcome. What has this study added to our knowledge? This study has made us understood better the clinical characteristics, outcome, and appropriate clinical management of Tropidolaemus subannulatus and Tropidolaemus wagleri bites in Malaysia. As an introduction, REX is a specialized risk management support system that assists all healthcare professionals at all stages of clinical management of for snake bites, as well as bites and stings or poisoning from other organisms. There are approximately 200 species of snakes in Malaysia, with 20% being medically significant. Among the pit vipers in Malaysia, the Tropidolaemus species is one of the common causes for venomous snake bites. There are two Tropidolaemus species in Malaysia. Tropidolaemus wagleri is indigenous to West Malaysia, and Tropidolaemus subannulatus is indigenous to East Malaysia. This is a picture of adult female and adult male Tropidolaemus wagleri, and this is the picture of adult female and male Tropidolaemus subannulatus. So in both species, the juvenile features looks the same for male and female. However, as they matures, the adult female and male morphological changes. In WHO guidelines for the production, control, and regulation of snake antivenom immunoglobulins, Tropidolaemus subannulatus is included in category 2, in which highly venomous snakes that are capable of causing morbidity, disability, and mortality, in which the clinical data are still lacking and less frequently implicated. Therefore, this study provides the evidence for revision of Tropidolaemus subannulatus from WHO category 2 list of medically important venomous snakes in Malaysia. The general objective of this study was to document the characteristics and significance of Tropidolaemus species bite envenomation consulted to REX from 2015 to 2021. The specific objectives of this study was to determine the incidence, geographical distribution, clinical features, clinical management, and outcomes of Tropidolaemus species bite envenomation in Malaysia from 2015 to 2021. The hypothesis of this study is Tropidolaemus subannulatus cases is more frequently consulted to REX compared to Tropidolaemus wagleri cases from 2015 to 2021. Tropidolaemus species bite occurs more in the non-urban area compared to urban area. No patient bitten by both Tropidolaemus species developed coagulopathy and indicated for antivenom. All patients bitten by both Tropidolaemus species discharge well without prolonged hospital stay. This was a retrospective cohort study. Ethics committee and REX prior approval was obtained prior to data collection. The data of snakebite consultation was retrieved from REX consultation log and recorded using standardized data collection sheet. All data were kept anonymous and confidential. All confirmed Tropidolaemus species bite cases in Malaysia consulted to REX from 2015 to 2021 was included. Other species and unidentified species bite cases was excluded. There are a total of 5,820 REX consultations during this study period. Out of this, 81% was snake-related injury, with 45.9% classified as identified. There are 310 confirmed Tropidolaemus species bite cases. 161.3% were Tropidolaemus subannulatus, and 38.7% were Tropidolaemus regulari. So this graph shows an increasing in trend of the Tropidolaemus species bite cases over the 7 years period. So based on this table, the majority of patients were Malaysian, male, aged between 40 to 59 years old. Most of the incidents are non-occupational related injury, and most of incidents also occur between noon and 7 p.m. in outdoor settings. So greater exposure to outdoor activities and the patient encroaching into the snake's habitat may contribute to these findings. The majority of consults for Tropidolaemus subannulatus cases was from Sarawak, and the majority of consults for Tropidolaemus regulari was from Perak. Most patients were bitten once, and the highest number of anatomical region involved was upper limb. The majority of patients performed inappropriate first aid intervention prior to hospital arrival. And among these inappropriate first aid intervention, tourniquet was the commonest. And most patients presented with signs and symptoms of puncture wound and local pain. Okay. So antivenom is not indicated for Tropidolaemus species bite envenomation. However, 2 cases of inappropriate antivenom were administered without any complications. Antibiotics is indicated in the case of patient developing secondary infection. However, 2 cases where intravenous cloxacillin were administered without proper indication. No cases that requires any surgical intervention such as wound debridement, fasciotomy, and amputation were recorded. Most patients presented with mild pain, and the most analgesics used was paracetamol. So type of analgesics used positively correlated with patient's pain score. Most patients stayed less than 24 hours in hospital as there was no serious envenomation side effect and no cases of morbidity and mortality recorded. Okay, as for discussion, first, Tropidolaemus species are defensive, arboreal, nocturnal, and lives in wet lowland forest area. Most cases involve patient being bitten once. Tropidolaemus species only strikes when provoked, disturbed, or accidentally stepped on. This shows the defensive nature of Tropidolaemus species instead of being an aggressive snake. And majority of patients were bitten on the upper limb, which shows the arboreal nature of Tropidolaemus species. However, lower limb also has high cases as many cases involve patient accidentally step on the snake. Most cases occur during daytime. This, however, contradicts with nocturnal nature of the snakes, and this may be due to higher human activities during the day. And lastly, the location of incident happened more at orchards, farm, and plantation, which correlates with Tropidolaemus species habitat, which is wet lowland forest area. Second, Tropidolaemus species bite only cause mild to moderate local envenomation, such as local pain, puncture wound, localized swelling, and erythema. Vasoactive substances and enzymatic toxins cause the local effect. And there is no life-threatening systemic envenomation in all patients were identified. No cases of tissue necrosis, cardiovascular instability, and also coagulopathy. And third, antivenom is not indicated. Supportive management is the management of choice. Analgesics used positively correlated with the pain score. And antibiotic is not indicated if there is no bacterial infection. Lastly, no mortality and morbidity reported in our study, no life-threatening systemic envenomation were documented. WHO Category 2 listing of snakes with secondary medical importance should be revised to exclude Tropidolaemus species, Tropidolaemus subannulatus from Malaysia. So our study is only limited to confirmed cases of Tropidolaemus species bite in Malaysia consulted to REX. Our study also did not analyze all Tropidolaemus species bite cases in Malaysia. However, it provides a good representation. There are possibly more Tropidolaemus species cases classified as unidentified snake-related injury. And this study also did not analyze post-discharge well and to come again when necessary. In the future, we recommend research for future analysis to involve all hospitals in Malaysia. We also would like to further study on venom components and toxicity of Tropidolaemus subannulatus and research on developing snakebite identification kit, especially for unidentified snakebite cases, would be beneficial in the future. In conclusion, regarding snakebite management is important, which includes proper species identification and appropriate diagnosis for optimal management. Majority of Tropidolaemus species bite envenomation cause mild local symptoms and do not require antivenom. As for clinical management, analgesia, close serial monitoring, and short hospital stay are recommended. Tropidolaemus subannulatus should be excluded from WHO Category 2 list of medically important venomous snake in Malaysia. These are our references. With that, thank you. Actually, for this species, Tropidolaemus species, is not indicated for antivenom because it only causes local symptoms. And patient only analgesia and also cross-serial monitoring and short hospital stay are enough, sufficient to treat these patients. However, in our study, we found out that there's 2 cases that requires antivenom, which is actually wrongly indicated. Bukan required. Wrongly given. Yeah.
Most of the cases admitted how long?
Less than 24 hours.
Less than 12 hours.
Yes. So other also, yes. Others also, but the majority for Tropidolaemus subannulatus is from Sarawak, and majority for Tropidolaemus vagreri is from Perak.
So most of the cases is
Hospital.
They referred this to KK and they give them from KK to hospital.
Yes. Vagreri. Analgesia, short hospital stay, and cross monitoring. Symptomatic treatment.
No mortality.
Yes.
No. So tadi soalan green pig virus.
Green pig virus. It's a type of pig virus.
But not venomous.
Not venomous type.
Venomous.
It's actually
It's
venomous.
a venomous type, but the venom is not less toxic to humans, so it only causes local envenomation only.
The venomous, what teacher said. But the venom is not venomous.
We all just tengok data, we all tak pergi dekat field site ke tengok betul-betul.
Yang ni outdoor tu, this ni find out outdoor ni, maksudnya kat mana?
Dekat farm, dekat kebun.
Roadside plantation, kampung lah. Plantation.
Lagi dapat you all ada data to compare cases daripada kawasan bandar, building, kan kita ada landed house, landed property kan, kadang-kadang kita beli rumah dengan bandar dengan kampung. Mana yang common? Pada data yang
Kampung, non-urban.
non-urban. Ya. Example?
Example tempat.
Location.
Dekat Sarawak. Sarawak yang banyak dekat not bandar punya area.
How many cases ni kan?
63.
The highest is in Larut and Matang.
So ada detail about the situation, example, hiker ke, farmer ke, ada tak detail? Dia punya working and job.
Kerja.
Domestic ke, occupational ke, recreational ke?
Mostly tak.
Domestic.
Mostly tak.
Macam saya
Apa maksudnya? Bagaimana maksud?
dia tak buat bekerja.
Waktu dia bukan tengah bekerja.
Dekat luar rumah contohnya, and then dia terpijak pula. Most of them just terpijak pula.
Ataupun masa dorang selalu macam dekat kampung tu dorang ada tanam something dekat belakang rumah dan masa tu dorang nak petik cili ke buah macam tu dan suddenly kena patuk. Most cases pun banyak macam tu.
Macam mana ada you all punya data tu?
Kita orang dapat tengok the Rex punya consultation log, WhatsApp chat semua tu. So kita nampak lah ada gambar kronologi cerita dia macam mana dia kena bite macam tu. Mechanism of bite.